Welcome, everybody. Really excited to welcome you to this morning's Helen Glass Research Symposium events. And this morning, we're thrilled to have our second scholar with us, Dr. Elizabeth Creamer from Virginia Tech University. My name is Dr. Christina West, and I am chair of the Helen Glass Research Symposium Planning Committee. So on behalf of the entire committee, I want to thank everybody for making the time to be here today. And I know this is going to be such an exciting research workshop for us to share together. I'll just let you know that as we move through this morning, about halfway through, we will take a 10-minute break so everybody can have a little break and get a drink if they would like to. So welcome, we're just so excited. And I just always around this time think so much about Dr. Helen Glass and her huge legacy for us here in the College of Nursing. And Dr. Neetha Dick, who is our dean here in the College of Nursing, will speak more about Dr. Glass in a few minutes. But before we begin, I would like to offer a land acknowledgement. So today, we acknowledge that the University of Manitoba campuses are located on the original lands of the Anishinaabeg, Cree, Oji-Cree, Dakota, and Dene peoples, and the homeland of the Métis Nation. We acknowledge the harms of the past and dedicate ourselves to move forward in partnership with Indigenous communities with a commitment to truth and reconciliation. So thank you again. I'm just so excited about Dr. Creamer's research workshop this morning about integrating qualitative and quantitative data and analysis across the research process. I've been able to share some conversations with her before today, and I know this is going to be just a wonderful extension of what we heard from Dr. Cheryl Poth on Monday, and just such an opportunity for all of us to learn more about mixed methods research methodology. So welcome, Dr. Creamer. I'm going to hand over some opening remarks to our dean, Dr. Neetha Dick from the College of Nursing, and then Dr. Susan McClement, who is the Associate Dean of Research here in the College of Nursing, will introduce you more specifically to Dr. Creamer and her work.
Thank you very much, Dr. West, and good morning, everyone. It's wonderful to see you all, and thank you so much for joining us. A special welcome to you to the 2022 Helen Glass Research Symposium. As Dean of the College of Nursing at the University of Manitoba, it's my pleasure to welcome you and to, it's such a highlight for us each year to host this research symposium. And it provides us with an opportunity to just engage and be inspired by our Helen Glass scholar. And so I'm just delighted and thrilled to welcome Dr. Elizabeth Creamer as our Helen Glass scholar for today and her session on mixed methods research. So certainly an internationally renowned researcher. We're just delighted to welcome her here. So I just thought I'd take a few minutes just to tell you a bit more about Dr. Helen Glass, as this symposium is generously supported by the estate of Dr. Helen Glass. She was a dedicated pioneer of the nursing profession, an esteemed leader, colleague, and friend. Dr. Glass provided leadership as the director of our School of Nursing from 1972 to 79, and was instrumental in establishing a graduate program in nursing and creating what is now known as our Manitoba Centre for Nursing and Health Research. With her influence and expertise, Dr. Glass's impact extended well beyond the provincial boundaries, as she provided leadership at the national level as the president of the Canadian Nurses Association. She was influential in shaping the wording and scope of the Canada Health Act in 1984, particularly in relation to primary health care. She advocated for the inclusion of nursing and allied health professionals alongside physicians in the delivery of primary care services. Internationally, Dr. Glass provided leadership as the first vice president of the International Council of Nurses. There's so much more that could be said about Dr. Glass, and she received so many accolades and honors, including the Order of Canada. And as one of the most influential nurses in Canada and beyond, we continue to celebrate her extensive contributions in nursing education, research, and practice. Most recently, Dr. Glass was named posthumously as one of the 150 women trailblazers by the Nellie McClung Foundation. Dr. Glass was adamant about bringing champions in the area of nursing research to the University of Manitoba to share new perspectives and stimulate the generation of new ideas with nursing students, faculty, staff, and the public. And so we're thrilled to sustain this legacy and are delighted to welcome Dr. Elizabeth Kramer as our keynote speaker for today. So huge thank you to Dr. Tina West and her planning team for their leadership and exceptional work in organizing and hosting this session today. So thank you again for coming, and let's enjoy the session.
Good morning, everyone. I am happy and pleased to formally introduce to you our speaker for today, Dr. Elizabeth Kramer. So let me tell you a little bit about your presenter. She's a professor emerita from the Educational Research and Evaluation Program in the School of Education at Virginia Polytechnic Institute and State University. She's an applied research methodologist with a principal interest in mixed methods and how it can be partnered with qualitative approaches. Over the course of her 35-plus-year career as both an academic and an administrator, Dr. Kramer has authored 5 books or monographs, 124 journal articles and book chapters, delivered 95 conference presentations and workshops, including many at international venues. Since official retirement, she has remained very, very busy, authoring 2 textbooks about mixing methods, entitled An Introduction to Fully Integrated Mixed Methods Research with SAGE in 2018, and Advancing Grounded Theory with Mixed Methods, published in August of 2021 by Routledge, Francis and Taylor. Dr. Kramer was the 5th president of the Mixed Methods International Research Association, serving a 4-year term on the board of directors. During that time, she's led efforts to offer monthly webinar series and co-chaired an initiative to organize the first ever virtual international conference. Her newest writing project involves a new textbook entitled Leveraging Visual Displays During Analysis in Mixed Methods Research. So with that, by way of introduction, welcome Dr. Kramer, and we look forward to your presentation today.
Well, thank you so much. It really is a true pleasure to be here. It's been a real honor to be invited and to meet these wonderful people that are working with this research symposium. The enthusiasm is just contagious. So before we begin, I want to say that I continue to modify my slides even as late as this morning when I woke up thinking, oh, I should do that. I should take those out and put these in. But I wanted to ensure that there was some time and flexibility for questions. They really make a huge difference to hear your thoughts and questions. I did a webinar last week and someone made a comment that is reflected in some of the things I talk about today and in some of the writing I'm doing. So usually, almost always, there's a nugget in there that makes me realize something about mixed methods. So we'll pause, as Dr. West has said, in more than one place for questions. So let me give you a little bit of background about my orientation before we jump in. As was mentioned, but I guess the timing was a little different. As was mentioned, my first textbook was called An Introduction to Fully Integrated Mixed Methods Research, and it came out the year that I retired in 2018, which is not the ideal time to be publishing textbooks. If you're in that order, I suggest, and boy, would a mixed methods textbook, a textbook about mixed method in nursing be a big seller. I encourage you to do it more. I'm not a great role model because it should be done mid-career. If you look at my second book and my upcoming third book, I want you to notice the hands. Did you see the hands? So my second textbook came out in 2021, and it's about pairing grounded theory with mixed methods. And to be honest with you, I wasn't fully aware that it may be the first textbook to really consider a qualitatively oriented mixed methods to consider qualitatively oriented mixed methods research. Not just side-by-side partnering, but a serious partnering of methodological assumptions. So it's already being adopted, I'm gratified to say, in qualitative research courses, following probably the introduction to basic methods. The next one I'm doing, I've gotten really captivated by the use of visuals, and you'll see that when we get into mixing, I show you a lot of visuals. Not as common in qualitative research as quantitative research, but important to the multi-dimensional thinking that characterizes mixed methods. The other thing I want to say about my orientation is that I think of my identities. My first identity is as a reader. I was a reader first, then a writer, and then maybe a researcher third. And I really I read very, very broadly across disciplines. And one of the things that concerns me sometimes about mixed methods is how narrow the reading is. So by pointing to cross-disciplinary, I'm saying that, for example, I've read into the nursing literature. I'll present some good examples of research that has been done by nursing educators. And I think it's the cross-disciplinary perspective is what is so important to knowing mixed methods. So we're going to have several polls throughout so I can keep engaged with you and see a little bit more about you. So here's our first poll, and it's just curious how many of you attended Dr. Hov's presentation on Monday afternoon. So if you'll indicate yes or no, I only see one answer so far. Perhaps it's not working, or
It came up for me, Elizabeth, so it went in. So Teddy, you have the...
Oh, it's letting me. I had to hit submit, and I just submitted a poll response.
Do you see the percentages of the yeses and nos?
No?
No.
Okay.
Will you read them to us?
Yes. On the yes side of things, it's 20 out of 30 people. That's 67%. And on the no, it's 10 out of 30, 33%.
Oh, thanks. It's not necessary, of course, to have attended. It's just, I'll loop back to some, oh, there, now I see it. I'll loop back to some of the things that she said. We think very similarly about mixed methods. So I want to talk first about definitions and misperceptions about mixed methods research. The center part 2, is about mixing different creative ways you can integrate your data during analysis. And I'm hoping by presenting those ideas for you, the visuals, that you could think of ways that you could adapt them in your own research. I'm not suggesting any of them as templates or standardized or anything like that. I'm presenting them as a way to spark your thinking, to perhaps be more original and creative than many of us get the impression mixed methods can be. And that's certainly something that's important to me. It's the endless opportunities, the ability to adjust mixed methods to different environments that I think is critical to its salience nowadays and why it's so important. And I know that was the theme of the symposium on Monday. The last section is about reporting. And part of the importance of addressing that is I think that people really often underrepresent or don't maximize in their articles leverage some of the potential that is in mixed methods, that some reporting guidelines really limit us in doing what sometimes later seems obvious, but helps the receptivity to an audience. So I mentioned we're going to talk about rigorous qual as compared mixed methods research that has a rigorous qual component. What is a non-rigorous qual component? I'm going to review one major misperception about MMR that's related to paradigms. This third one is related to the integration I mentioned. And then I want to talk about reporting processes because there's some controversy involving them that I want to acknowledge as well. So here's another poll. Let's see if we can see if that one this one we can work up. How familiar are you with mixed methods research? Not at all. I have a basic introductory knowledge. I'm familiar with some of the literature. I have taught a mixed methods course. I don't expect many to be in that block. Oh, good. So there's more than, I responded as well. So there's more than just me who's taught mixed methods. Some from, oh, look, this 85% have some familiarity with mixed methods. Oh, that's very exciting. And then there's always a huge range in webinars. So do not be self-conscious if you're in the not at all. That we'll recognize that. I want to say first, in looking at mixed methods relative to nursing, and I want to acknowledge, or I think it's important or helpful, I should say, to recognize that there are at least two first-generation scholars, and by that I mean were very influential in the 80s and the 90s and onward in the establishment of the foundational knowledge about mixed methods. So mixed methods emerged from the evaluation movement. It started gaining pretty serious traction in the 80s, both in the United States, Canada, Europe, and later on in other places. Both these researchers happen to be US-based people, and I have no idea how familiar you are with their work. I feel like I know them both because I've read so much of their work, but I actually have never been in the same room with Janice Morse, though I have been in the same room with Marguerite Sandlewiski. Marguerite's from the University of North Carolina, Chapel Hill. Both of these people are retired. Janice Morse was an influential editor of a journal from Utah. You may be familiar. She's strongly associated with a partner province, Edmonton, Alberta. Very, very influential in thinking about mixed methods research. Sandlewiski is a bit of a critic. She always brings a very fresh perspective to any method. Both of these are strong qualitative researchers and mixed methods researchers. Influential people, very influential people. I want to continue to emphasize the role of mixed methods in nursing. And I want to emphasize that it's not new to nursing. It has been a fixture of the nursing literature, maybe as far, certainly in the 90s forward. This table is actually from bibliometric research looking at citation practices. And I just show it to you, not because I think it's necessarily complete, but to show that in the listing from the research this group of scholars did, among high impact journals that reflect mixed methods, I want you to notice that 1, 2, 3, 4 are from nursing. 1, 2, 3, 4, 5, 6, 7, 8. There are 9 listed in the top, high impact, that are from nursing. So mixed methods has a history in nursing. There's some journals I know that you'll probably be surprised are not on here. That probably has as much to do with their methods. But this was a very comprehensive study of citation practices. Now, I mentioned Janice Morse from Edmonton, Alberta, and she's associated with the Qualitative Health Research Journal, a very influential journal. She reflects what I want to call a school of thought. And I refer to it as a school of thought to help people realize or to emphasize the point that there are different perspectives about mixed methods. That can seem confusing, but I think it allows you, if I could use this word, to self-author your own understanding of mixed methods and how it suits your work once you begin to grasp the complexity of it. Now, I don't know if her ideas changed, and this should be Morse rather than Morse, since 2014, but she takes a one-of-a-kind position that it's not really one of a kind, that's an overstatement, that mixed methods studies are really 1.5 studies. She does not support the idea that qualitative and quantitative, the qualitative and quantitative components can be equal, can contribute equally to insights. It's her opinion that one is necessarily supplemental. And by supplemental, she means it could not stand alone in a publication. It's not strong enough to appear in a publication. So as an editor, has a very strong influence. I learned from her actually the strength of the influence in terms of what appears in this particular journal. So an example, for example, of a supplemental component could be a study of a clinical intervention, an experimental design, that with a quantitative drive, but perhaps has a small qualitative component. Perhaps the qualitative component led to an instrument development. Perhaps it led to the design of an intervention, but that's not the part that gets published. So this is not a view that is mainstream in the mixed methods world outside of this particular school of thought, but I wanted to recognize it just to show, again, that there are different views about mixed methods. My own research has been influenced by these people. I'm mostly influenced, has been strongly influenced by these particular sets of authors. And I bring this up again, not to highlight myself, but to suggest to you, if you're really interested in qualitative research and the role it can play in mixed methods, these are the these are the people that you will find compatible to your orientation. These are the people you should be reading. Joe Maxwell is mostly qualitative. He's written some very influential qualitative books. He's much interested, he calls himself a critical realist because he's interested in causality in qualitative research, of course, defining it in a very different way than it is normally defined. Pat Baisley is an Australian, a long history of emphasizing integration, many books about using qualitative software. Another very easy person to read. She would call herself, I believe, a pragmatist. So notice that I've labeled people's points of view. I'm calling my own views postmodern because of my interest in diversity and difference. Jennifer Green wrote a very influential mixed methods book in 2007. Her background, she's a US scholar, also recently retired, who comes out of the evaluation movement. I would label her perspective as constructivist. Finally, Charlene Hesse-Barber from sociology avows or positions her work as feminist and transformative. So her research could be helpful to you if you are involved in the type of action research that is trying to promote equity, improved healthcare, better access to healthcare. So there's so much written about mixed methods now. I mean, it's almost overwhelming. So I recommend to you that you target your reading to people that are helpful to your own priorities. And these, of course, can vary substantially. All definitions of mixed methods research see it as the integration of qualitative and quantitative data analytical procedures. That's core to all definitions. As Dr. Poff mentioned, people tweak definitions, but the three words qualitative, quantitative, and integrative are in them all. You can see my own value priorities because I see that an integrated approach means that you are going to engage many perspectives. Part of your purpose is to understand different perspectives. Some people link that with a paradigm called dialectical pluralism that Burke Johnson has written about. Green coined an expression that she refers to mixed methods, a mixed method way of thinking. And so she's framing it as a way of thinking, and this is quite consistent with my perspective that it's a way to engage difference versus a more confirmatory drive that you're using it for confirmation that's associated with positivist, a more positivist and post-positivist perspective. So common to all definitions is those three parts. The commitment to engage difference is how I have personalized it, self-authored it to my own paradigm. So we're coming into some, I was joking with the other panelists that I have many variations of this screen with the three circles. One of the biggest misperceptions about mixed methods is that anything is mixed methods if there is a qual and a quant method. So if you had surveys and interviews, it's automatically mixed methods. That's not the case, though commonly ensued, because mixing or integration, linking of those two, combining of those two through various means is essential to to calling research mixed methods. How big the mixing part is varies from study to study. So what is mixing and what is integration? Is the difference important? For everyday practice, no. For scholarly discussion among methodologists, yes. The word mixing is used, or is most appropriate when mixing is done through one procedure, a joint display, a table that combines mixed methods, that combines qualitative and quantitative data. Mixing is a good use of that word. Integration suggests a more systematic approach to linking qualitative and quantitative data or methods. And this is a cite from Moore and Ellis. So integration suggests a more cohesive approach that might extend, for example, across more than one table or figure in reporting. So I mentioned that I'm an editor of a journal. I didn't mention that, but I edit a journal called Methods of Psychology. And I'm the executive editor-in-chief of the mixed methods strand. This is a methodological journal, not a content-oriented journal. So like Nursing Inquiry is content-oriented. This is to share information. A methodological journal shares information about methodologies. It's very, very common for me to receive submissions. And in the field of psychology, mixed methods is not as pervasive as it is, I believe, in nursing. It's very common, in fact, it happened to me last week, to receive a manuscript from someone that checks the box, mixed methods, so it's routed to me. But when you pull up the article or the manuscript, mixed methods is never mentioned once in the manuscript. The assumption there is if I use more than one method, it's mixed methods. So that mixing component is what changes things. I think the idea of it being separated and having a distinct qual and quant strand, the more that these are often very distinct, not integrated, I think is the basis why so many people have been discouraged from doing a mixed methods dissertation, or perhaps being discouraged from mixed methods at all. What do I mean by that? As someone who advised people doing dissertations for most of my career, you're trying as an advisor to help people do doable research that they might complete before they become grandparents. So you want it to be sufficient to warrant a dissertation, but not to be so overly ambitious. So as an advisor, when someone comes in with a proposal that seems to be two different studies, or seems to have such a strong qual and such a strong quant, and they're addressing separate research questions, then the advisor says, oh no, you've got two studies there. You really only need one for a dissertation. You've got two studies there. They're really intending to try to make your life easy, or even though it doesn't feel that way. So the presentation of this as mixed methods is only a qual piece and only a quant piece, and that those two should be kept separate, I think is at the base of this great discouragement from doing mixed methods research. In a webinar I did last week, one of the participants said that her university did not allow mixed methods dissertations. I find that pretty amazing. In my own work and wide reading, ever on the search for exemplars, many of the exemplars I use, most of the exemplars I used came from dissertation research that somehow managed to fit itself into a publication. It's my belief that's where the most innovative research is being done, is in dissertations. So back to my little circles, which I didn't even color, but I had imagined sort of making them jump around, but I restrained myself. This is what most mixed methods research appears to be through the way it's reported. And this was part of my insight that came recently from the way it's reported. So there's much research that's demonstrated, systematic reviews. There's a body of literature that is documented beginning, I think, in the early 2000s with a seminal piece by Alicia O'Kathian in Europe, that most mixed methods research is quant dominant with a very small incidental qual piece. This is what most mixed methods research looks like across a spectrum of journals. No attention to mixing, very trivial qual. And one of the things Dr. Post said the other day that really caught my attention is you cannot have quality for a project or study unless both parts are rigorous. You cannot have quality when one part is not rigorous. So let me ask, I'm afraid to ask, but I will ask, how many of you have been discouraged from using mixed methods? Oops. I want to go, there you go. 42%. That always amazes me. Last week it was like 56%. So that maybe that's the context of nursing. So generally, and I think this might be a good place to pause for some questions right after this before we go on. To think about the reasons why people are discouraged from using mixed methods research. And I mentioned a few of them. So let's stop here for a minute and ask Dr. West to look at the chat box and see if we have some questions related to what I've talked about before, even not related to what I've talked about before.
So I have the chat box open, and there's also the question and answer box. So please send any questions that come up or that you have for Dr. Creamer into those, and I'll read them out for her, similar to Monday.
That would be great. Hopefully I've stirred some ideas.
So Dr. Marnie Kramer offered not enough exposure to mixed methods research in theory classes in the doctoral courses.
Yes, that's a good reason. There's people have written about this increasingly. It was radical at first for people in the 90s and after to get exposed to qualitative research. But I agree with that observation. There are not enough graduate programs that include mixed methods. Part of that, I think, is associated with the assumption that they are so different. And therefore, you need a qual class, a quant class, and a mixed methods class. Instead, I think there's tremendous benefit to courses that allow you to think about a research problem or question qualitatively, quantitatively, and in a mixed methods way to investigate what is gained by the different approaches and to consider the way they overlap. But in some fields, that lack of training is more pronounced than in others. I know in psychology, it's still very, very rare. I taught a mixed methods course in education starting in 2007, the same year as the Journal of Mixed Methods started. But even that was quite unusual. So there's no question that that observation is accurate.
I also think, like just for myself, that piece about the philosophical paradigm that's guiding the research and the question of mixing those different lenses. I know you're going to speak a bit more, but I do think that is something that is challenging to
Definitely.
move, to get our heads around. I think particularly like in graduate school, when it's so challenging to just kind of understand something like from a qualitative perspective and what's the kind of philosophical paradigm guiding that kind of work. And so then I think the complexity of like really having that integration and exploring the value and how you would do that, I think is one of the pieces that for me, and we've talked about that. I know you're going to speak to that a bit more.
Yeah, it has been the issue of the idea that qual and quant are distinct paradigms. No, I won't say that the issue, not that they're distinct paradigms, but they're so distinct they can't be paired or partnered in effective ways, is probably the single most persistent question about mixed methods. You put your finger right on it, Dr. West.
Great.
It started from the get-go, from the earliest days, and it persists. It's very rare for someone to make a mixed methods presentation to a generic audience that includes qual and quant people, forgive the polarization, not to be asked the paradigm question. Yeah. So it's a good question to have a prepared answer for. I'll try to do that.
And I have a few more questions here.
Great.
So, from Dr. Kim Mitchell, who sent actually 2 questions. Given what you say about the importance of mixing when using sequential mixed methods, are there strategies you will discuss that show how the mixing might work if the qual and quant components are done separately, or do they always have to be done at the same point in time?
They probably, and what you're referring to, I think the concurrent design where the two are qual and quant are analyzed separately is a more common design, but the signature of a sequential design, regardless of whether it's exploratory or explanatory, is that the second part is not possible without the first. So the most common example of that, and that's generally referred to as mixing by linking. Mixing by linking, if you're looking for mainstream language. The most common manifestation of that is instrument development, where perhaps the first phase is the qualitative phase, perhaps community engagement, focus groups, observations, to develop key concepts and constructs and language to use in a instrument, some kind of instrument. It could be an observation protocol, or it could be a survey. So the second phase couldn't happen without the first. So an integration is occurring there because those phases are interdependent and linked. That is a excellent use of mixed methods.
Thank you. And then the second question, which another participant asked as well, just around the observation about that 1/2, usually the qual is diminished in publications. Just a question about, is that possibly related to the limits, the journal, like the manuscript word limit? So somebody said in nursing, right, that often it's limited to 3,000 to 6,000 words. So do you feel that's a part of it?
I do think some of it is in reporting. I didn't used to think this, but somehow I do think the reporting standards are getting in the way of, are part of the reason are getting in the way of giving the qualitative portion the attention that it needs. So an example of that is instrument development. Let me go back to that example. So let's say you did an instrument development, a rigorous instrument development project to develop a protocol or survey. And then you produce an article that reports on the results of your survey, calls it mixed methods. But often what's happened is the qualitative section gets so little attention that then people say, oh no, it's quant. Look, all they're showing in their tables or figures is quant data. This isn't mixed methods, it's quant. Or this isn't mixed methods, it's multi-method. So that's where I think the reporting plays some role in that little tiny qual. I agree with you on that.
Yeah. And just one more question, which I think is important from a doctoral student. They say they intend to use mixed methods for their dissertation, but what do you suggest if their dissertation team are not familiar with mixed methods research? Suggestions for navigating that? And I was reflecting on that. I mean, because I do think the limitation around, like the number of scholars who have expertise around true mixed methods research with integration. Don't know if you have any suggestions for them.
I do. And I may sound like I'm being facetious, but I'm not really. I don't know if people sit down with their committees anymore, or if it's entirely virtual now. But I would suggest the strategy, if you were sitting down, and I think you could make this work in Zoom too, that you just pull out examples of articles. I'm going to give you the one in the end to pull out that's from a nursing educator, her dissertation, Christina Cotello. I would just pull out those articles and lay them out near me and refer to them, so that you also acknowledge that some of your role, even though that it seems unimaginable, is to help educate them. So for instance, a committee member says, no one does research in mixed methods in nursing. And you pick up an article and you say, well, this person was doing this. So that also means you have to do your homework in terms of your familiarity, particularly with mixed methods in your own discipline. They're not going to be so interested, in my opinion, in what they do in public health or architecture. But when you pull up some of these stellar examples, and there are many that involve the health sciences and nursing, and I make a distinction between those two. I know you overlap. That's much more credible to them. So I acknowledge that there's a role in educating a committee. Sometimes people do, if they're lucky to get a mixed methods person to sit on a committee, agree to sit on a committee. That's, of course, another way people do it. but those are rare too, I understand, and they may not be in your own home environments.
I guess a question too that comes up for me in relation to that, if you don't have somebody that has that mixed methods expertise, is it then even thinking about the qual and the quant being rigorous? Is it important to think about having like two people on the committee that have strong qual and then strong quant to bring that expertise to what you're doing? Is that something you would think about?
It's the qual, that it's still the qualitative portion that is missing often.
Right.
So you're exactly right on that, that the qualitative, an informed qualitative person, who honestly, in my experience, are much more friendly, though not always, to mixed methods. That's a very, very important component. That's a very good recommendation. They're, I'll say, more willing to accept the interpretive component that requires meaningful mixing. It's more familiar to qual researchers than to quantitative researchers.
Thank you.
Sure, probably better. We'll move on a little bit. Love the questions, so keep posting them. They're just so wonderful. See, they make me think more and bring out more subtle points, I think. Let me give you some telltale signs about trivializing qual. They're quite common, but they can explain why that little circle often comes across as being very small, so small that it is supplemental, ornamental. Dr. Poth the other day was looking at a continuum of integration, and on the lowest side, I think she had some ice cream with sprinkles on the top. And that really captures situations of common uses of qual in mixed methods in fields where quantitative is so dominant. And I don't necessarily include research in that. The sprinkles on top. One of the ways it's most likely to be seen is when there's no separate analysis of the qualitative data using grounded theory, discourse analysis, any established tradition, but that the qualitative data is used to add human interest to quant findings. So the telltale sign of that is there's no substantive method section about the qual, no sites that suggest any familiarity with qualitative methods. But yet in the results section, it's usually called results, the quantitative results, quotes from the qualitative data are inserted. Sometimes you see this in joint displays as well. So those are two really big signs. Nothing in the method section, but quotes interspersed to highlight, or as an example, to illustrate what was found quantitatively. Another dead giveaway is a tiny qual sample. And by that, even under 20, I mean, it's not uncommon to find research reporting qualitative research with samples of 8 and 10. That's just not credible, to be honest with you. It's just not credible. If you have a diverse population, there's no way that small kind of sample can represent or communicate that kind of diversity. Another dead giveaway is that all the questions are quant. Their effectiveness on that, the drive to predict, there's no classic qual question. Now, a classic mixed question, standardized, is what's the difference between the qual and the quant findings? So that's a very standardized mixing question. So this is where design and not just reporting can suggest a tiny qual, so tiny that the quality of the qual threatens the credibility of the quant. So before we get in, well, we've got a couple misperceptions. I was going to say we'll probably take a break after misperceptions and then roll up our sleeves for ways to mix. So my next polling question, how well respected is qualitative research in your work environment? Oops, I do that every time.
And Dr. Creamer, just as people are answering that poll question, there was another question about, how you're talking about the qual being minimized in favor of quant. Do you ever see it the other way around, where qual is more prominent and quant has become supplemental?
That's a very good question. Definitely, hardly as common, because qual-oriented mixed methods research is still not that prominent. But let me give you two ways that the quantitative component can be so trivial. And in some ways is similar to the qual. One way is counting qual data. So you have qual data and you call it mixed methods because you count the frequency of themes or the frequency of the frequency of contexts. And that's trivializing the potential of quant. Not even sure that's good mixed methods. That's one example of trivializing the quant, and it's the most common. The idea that just counting qualitative data, and actually the software makes that easier. Oh, look at that. So that's encouraging. And I imagine that's encouraging that with the same respect as quantitative methods, that's progress. That's 61%. That's progress. This would be quite different in fields like psychology and where you just can't escape experimental design. So one misperception, not nearly as powerful as the one about paradigms, which I'll get to next, is the idea that even in fully integrated designs, which this is the first conceptualization in 2003 by Tasha Corey and Tedley of a fully integrated design, the idea that the two don't interact, this is a portrait of a concurrent design. It's like often on a team, one side does the qual and one side does the quant. And occasionally you meet in the same room and talk. Pat Baisley, a person I mentioned before, who's just written some fabulous books, particularly a new one about integrating analysis in mixed methods research, maintains, and I think this is very important, the strategy that is most destructive of coherent integration is to work through complete analysis of each of the separate sources of data available before considering how they might be integrated. What most people recommend, and what I recommend, is you do begin with separate analysis and using appropriate methods with both the qualitative and the quantitative. Perhaps you generate information about core constructs in a theoretical model from each, and then you bring them together to try to understand similarities and differences. So it's like you'd stop midway before you finish the analysis and bring them together. You bring them together here in the middle. This classic portrait has the idea that you would not bring them together until the end. And that's what Baisley is talking about. Then you generate, often this is placed in, like it's in the discussion section. You say, well, the qual and qual findings are alike in this way and different in that way. That can work very well in certain settings as well. So let's talk briefly about this paradigm spectrum before we break. And mention, with a good question from Dr. West, this is a pervasive question about mixed methods. You might hear it when you present, you might hear it from your committee. They can't be mixed. You can't mix them because they are opposing paradigms. Because they are opposing paradigms and therefore inherently incompatible. It's coming up on Halloween here in the United States. So these little guys are dressed up as ghosts. They're not my grandchildren because they have little dog faces, but this sort of reminds me of the specter of paradigms. This argument has been present since the very first days when mixed methods were being introduced. At the same time, qualitative approaches were new. So we're talking about the 80s, maybe before. Qualitative were being introduced, but had low credibility because the quantitative paradigm was so dominant. So much of the language about mixed methods that emerged from that generation is very sensitive to this concern. And where this concern is inescapable, you're drawing blood on a committee, you're drawing blood on a team. There's no in between. The quant researcher cannot embrace qual, and the qual cannot embrace quant. That's when the separate designs that were in the previous slide, that's when these are useful. That's when these are useful. When you're in that kind of environment where this is an intractable argument, honestly, I don't see how people do mixed methods research if they really believe that. Let me show you before we wrap up, and then we can return for some more questions because this is a big topic. I would suggest to you that the argument about incompatibility and therefore you can't integrate is grounded in paradigmatic assumptions. And those are about epistemological assumptions about knowledge. What is good knowledge? The role of bias. We all have these, but we're not particularly aware of them by and large. Positivists and post-positivist approaches prefer the approach where the two strands are kept separate, each with its own quality standards, each with its own principles. Constructivists, and some days I think of myself as a constructivist, really see them both as subjective in the sense that the researcher is an agent. The researcher is making choices and decisions. They accept that the role of the researcher more prominently in interpreting data. So once you get into paradigms like the ones I've listed that are more open to the idea that the environment influences findings, researchers' attitudes and opinions and biases influence findings, not necessarily in an entirely bad way, then you move away from the idea that you're going to contaminate things by bringing the two strands together. But hopefully what this tells you is that there is paradigmatic grounding to views about integration as well, and that these perspectives that I've listed are more compatible with the idea of an interactive exchange between the strands. And after we come back, I'll show you how, give you some concrete ideas. So let me stop there now and take a 10-minute break. It's 10:09 your time. So let's say 10:10 your time. Let's come back at 10:20 your time. All right, sound good? All right, we'll return.
Great.
All right, shall we get back?
Yes, please. So welcome back, everybody. We'll restart the session now.
Let me go back just a little bit to this slide. And I'd like to take a few questions after this because the paradigm issue is so big. Let me just say a couple more things about paradigm. Most of the research about researchers and their use of paradigms suggests that researchers are not conscious, I guess I would say, conscious of paradigmatic influences. They're doing their research generally in the best way they possibly can. They're trying to produce good research. They're implementing strategies that work in their settings. So even though at the methodological level and the philosophical level, there's a lot of discussion about paradigm, in everyday practice, most of us escape those discussions. That's one point. Second point is, personally, I think underneath the paradigm argument that they're incompatible is a statement about the credibility of qual. What they're talking about really is the qual portion, and whether they believe qual is can be done empirically and make a contribution. So it's a hidden way. So I promise to say, what do you say? And maybe some of the people in the audience may be able to suggest this too. What do you say when this argument comes up? You could say that it really matters. It depends on your paradigmatic orientation. That positivists and post-positives, by and large, prefer approaches that keep the methods apart and loosely connect them. That's fine. That's good mixed methods. There's nothing wrong with that. So the design of classic mixed method studies recognize that by suggesting that they each be analyzed with appropriate analytical procedures. So the paradigm, one way to say it, is designed to recognize that by insisting that the qual and quant be analyzed, at least initially, separately. So Dr. West, would you look in the chat and see if we have new questions related to paradigms, probably?
Yes, there's no new questions yet, so I invite people to send any questions or comments. There was one comment from Dr. Diana McMillan, who just a little while ago said, interestingly, if I think of nursing, then qual is well respected, but in the broader health sciences area, there still exists some opportunities for better understanding of both strengths.
Very well said. Very well said. When I said earlier, I make a distinction. I know nursing is part of the health sciences, but when you work in the NIH world, in the funding world, in the wider medical world, where randomized controlled designs are so prominent, that's exactly right. So let me move on and offer you some examples of the way you can integrate. And I want to say again, I'm not saying you must do any of these. I'm offering these mostly as a way to suggest, to give you ideas about how it has been done or could be done. The limitless possibilities Dr. Pove talked about. So mostly I'm going to talk about 2, 3, and 4, even though my book is really about this. So a conceptual theoretical model can, by using a set of core constructs and hypothesis, if you will, and I realize that's not a good word in qualitative research, by building them in across the phases of your research, they provide a tool to integrate. But mostly I'm going to talk about 2, 3, and 4. Right now in the mixed methods community, joint displays that include qualitative and quantitative data in a same table or figure is receiving the most attention as a way to integrate. And this is literally aligning data, qualitative and quantitative data by theme, for example. It's a classic way to integrate. But I would suggest to you that there are also 2 other ways that I'm going to talk about today, both of which probably are more qual-friendly. They've been considered qualitative strategies, but they can be mixed method strategies. So the first one is using graphic elicitation during data collection. The second one I want to emphasize is case-based analysis. And this is not case study, but close. And this is the one I really want to highlight for its potential when you're doing complex research. So let me launch the discussion about integrating during data collection, first by suggesting some basic ways that it can be done, it has been done. And really part of this is like taking the idea of a survey that has open-ended and close-ended questions and moving it into an interview. Let's just leave it at that, an interview. It could also be an observation protocol. So one strategy, and I work with a team who did this very effectively from Clemson, is to use an interview to ask both closed and open-ended questions. So let's say you're interviewing people who are recovering from hip surgery. I had hip surgery, so I can identify with hip surgery. And let's say you interview them week 1, week 3, week 5, and you ask them, how is your recovery going? On a close-ended scale, tell me how you would rank it on a 1 to 5 scale, your satisfaction with your recovery. Okay, let's say I give it a 4. And then the interview qualitizes, I'm going to introduce the word qualitizes, that number by asking a person to reflect what they meant by that number. You gave it a 4. Now, why on a 5 point, what does the 4 mean to you? The beauty of that qualitizing of the quant number is that then you could subsequently create a separate scale. I want to say standardize the scales based not on the number they awarded, but on how they described their 4. So the team I'm describing found, not surprisingly, that what I call a 5 and you call a 5 are totally different things. So you can weigh your qual data, sort it, not so much on the number. No, you create your own scale to measure the qualitative data. So people who, we're going to call people a 4 who describe their recovery this way, we're going to call them a 5 this way, so that it lets them reflect on a number. I'll come back to that. That's a very powerful approach. Another way that I want to talk about today that I'm very excited about, you could do this with maps too, is if you have anything that has a timeline to it, a sequence, whether it's retrospective, you're recalling a sequence, how I became a nurse, that's a timeline. When did you first think about being a nurse? What experiences, when did they happen? What types of experiences happened that made you interested in being a nurse? And then you put some of those, ask them to draw a timeline. And then the conversation you have with them is about the timeline. In my experience, interviews are more authentic. The data is better when it's organized around a document or some activity that they participate in. I have a weird philosophy about that. It's like they're paying attention to the activity, and so they say they're more authentic and less guarded in what they say, less driven to say what they think you want them to say. So let me give you an example of a timeline that I have used before. And I want to illustrate, I'm using this to illustrate how you can qualitize points on a timeline, annotate it. You could do it one of two ways. The researcher could construct the timeline after an interview based on interview data, or you can use the timeline as part of an interview. The trick in mixed methods is that there are 2 axes to the timeline. It's not just time across the bottom or points in time, but it's also this vertical axis that could be well-being, pain level, many different dimensions. In this case, these were economists, far afield. They're studying poverty status. This could be access to healthcare. You could use a time like this, experiences in the healthcare system. And they could rate them as good or bad on the other axes. So what's interesting about this is, so you're using it as a tool during an interview, or you're using it as an analytical tool. In that case, a visual display becomes a tool for analysis. And you're asking the participant to explain again this idea. So let's say it's over here, and your satisfaction with your experience in healthcare was low in one experience and high in another. One was at this time and one was at that time. Talk to me about the difference. And then you actually, in some cases, could fill it out with a participant. Where this can go quant is to quantify. So you're mixing right here, by the way, before I tell you the quantifying part. This is mixing. You've got one dimension that's quantitative, you got another dimension that's time. You've added qualitative data that plots. This could be recovery, interest in nursing, and you've added qualitative to understand ups and downs in that pathway, ups and downs and differences. What these people did that was absolutely remarkable and still one of a kind, this is a 2011 article, is they created a way to quantify the pathways. And then they use that in their statistical analysis. So if you go back to this example, you see it's up, down, but mostly down. If this was a learning trajectory, how much knowledge are my students learning about homeopathic medicine or something? Are they learning a lot and their knowledge increases, or their interest in nursing increases, or does their interest in nursing over the course, say, of a curriculum go up and down, up and down, up and down? This, of course, could be maintained by a student. So this is still one of the most creative uses I've seen of a timeline to try to overlay the trajectory of the timeline and to capture different patterns, steady up, steady down, up, down, even up and down, etc. You could use the same approach if you were working, again, let's say in a nursing curriculum, and you're gauging their enthusiasm to continue in nursing over the course of time. And perhaps you have some that have a steady positive increase, some whose views go up and down, some whose go up and plateau. You can cluster the people in the different patterns and then begin to analyze through a case-based analysis. What's the differences between these groups? You could simply qualitize it relative to what were we doing in class at these different times, but also what was going on. Perhaps they're in internships, perhaps they're in practicums, they're out in the field. That's what we call it in education. You probably don't call it that in nursing. So there's probably stuff going on outside of the classroom that's influencing these. And so the case base could be used to explore these differences between groups. This is another way to collect data in a matrix, and to use the matrix to consider differences between groups. So I had imagined this first, and I think Almaguzi has a name for this: inter and intra respondent matrix, I think he calls this. So first of all, it has two dimensions, two measures, two quantitative measures. When I first imagined this, there was a lot of literature coming out about the wonderful effects of nature and how nature, being in nature, there's a book out about it, how being in nature is so calming because it combines multiple sensations, smell and touch, and that actually it's been proven that the evergreen really has a calming effect. Well, I did this activity in South Carolina once, And their idea of being outside was very different from this book. And they all were horrified at the idea of going outside, because partly because it's so hot in South Carolina. So they weren't in support at all of this idea that nature influences your well-being. But say that at the bottom, there are all kinds, let's say on the horizontal, there's all kinds of well-being scales that have been standardized. They're not at all complex, 2, 3 questions. But say on this, you're proposing a relationship between love of nature, and you have a love of nature scale, and you have a well-being scale. So let's say the first step was you ask participants to put a dot in where they believe they are, or their attitude about that relationship. So again, going to see a doctor, you could use the same scale. Let's say you're involved in cancer studies. Going to see a cancer doctor for the first time. How anxious were you? Could be one of your scales. But let's say that first you ask participants to put their little dot in on the well-being scale and the love of nature scale, anxiety scale, and whatever here. And then you had these people qualitize their dot. So make some notes about why, let's say if I put myself in the high well-being, high, why I put myself there. Then, or you could move, after you put the dot in, you can do intra-group analysis, have all these people talk to each other. Perhaps they're the very anxious group about going to an oncologist, and you're trying to understand what influences their interest or fear about going to see an oncologist. And then this group meets and this group meets. So you in real life, you break them out into different focus groups, for example. And then you could see the enormous potential to begin to discuss differences, as well as to identify commonalities. So this is using, again, that you're living the constant comparative method, and that you're collecting data, analyzing data at the same time. This could really work in community action research, for example. If you're trying to get to issues of health equity and you want to engage participants, if you're trying to understand satisfaction with a particular service, this could be useful. So I mentioned that I think the case-based analysis is the most promising method. The difference I see between this and case-based. So case study is a qualitative tradition that produces case studies. Those are usually all text. The difference about case-based analysis in mixed method can be that you integrate data from many different sources into a single case. The case could be a group. It could be an individual. It could be a unit. So say an emergency room could be a unit. And take an emergency room in a hospital. You got all kinds of quantitative data about different emergency rooms. You've got usage patterns. You've got types of emergencies. You have all kinds of data. And then you can imagine bringing in those data to construct cases about a unit like an emergency room. So the important part of that, the difference is that you're bringing together multiple sources of data. For instance, let's say you just have a simple survey of first-year nurses, and you have different, you could be able to sort them on the different trajectories. You can create a case for all the people who are come from families that have nursing backgrounds, those that do not, those that have a certain procedure, those that do not, emergency rooms versus other kinds of nurses. Another way you can create a case, and you can imagine this could be like data in software. And let's go back to emergency rooms. Let's say you're comparing the arrangements of a community center and emergency room. The study I want to talk to you about later was all about the configuration of emergency rooms. And the thought was that more privacy would allow more honest reporting about sexual assault. So sometimes a case can have visual data, like let's imagine a picture of the space. Let's say where the emergency room is located. Where's the entrance relative to highways, relative to bus stops? That would be very interesting in research, say, involving sexual assault. And then, of course, you have all kinds of potential for quantitative data. The example I'm giving you is in my second book on grounded theory, and it's an examination of collaborative space and how it might promote creativity. But if you take that question about emergency rooms, sexual assault, just even the idea of how close it is to a bus stop could be an influential piece of information. So that you're moving, here's your case, and you're moving back and forth between these data essentially to generate new themes, new categories. So you don't stop here. It's when you bring them together, there's the potential to generate new ideas. So this isn't particularly, let me see how many of these I've left before we can do some questions here. This is returning to the example that I just introduced again, this study by Christine Catello, and it appeared in Nursing Research and Practice. And it's the example I'm going to use later of good reporting. But here's an example of someone, and this is a dissertation. The dissertation did not come out the way she expected. So she launched her dissertation, probably as part of a funded project, to test the hypothesis that more privacy would promote more disclosure among domestic violence victims. And that's not the way, domestic violence clients. She found just the opposite. It didn't work. Her intervention didn't work. It did not. The more physical symptoms they had, the more they had completed on a survey, and the more nurses observed, the less likely they were to disclose domestic violence. So I suspect she added a qual phase to explain the unexpected qual findings, and she used grounded theory. And she reported the grounded theory in a mixed method grounded theory study. Now, you can't tell this by this picture because this was a graph included in it. It's essentially a timeline. She did varied sampling among the people, her participants, then interviewed them and tried to trace critical events. So she had them essentially create a timeline, or I can't remember, maybe she put it on a timeline of events that led to disclosure or non-disclosure. And this would really fit well with using critical incident or even lifespan theory. So she ended up using a case analysis. This is qual, not mixed, for each individual person to understand critical turning points for them. I'll come back to this study. Here's a simple way. This is a joint display. It's also case-based. So this is one of the first that's come out in the mixed methods literature by someone. Mike Fetters is well known in the mixed method world, and he worked with Tashane Haynes Brown in her study of teachers. So this was a group, this was individual teachers' scores on a quant index, and then in the right, the qual data that illuminated those scores. So it's just putting them, the qual and the quant, in the same frame. Excuse me, it's almost like the same frame. Let's go back to resume the example that we had before of the different trajectories. So we had the up, down, we had the steady down, and let's say that we're doing a case-based analysis of all the people in these patterns. So we've generated, let's say we're in a situation where we've generated an integrated case. Maybe it's textual, that looks like Tashane Brown. It's got quant data, got qual data. It's about the people who lose their interest in nursing versus the ones who become more enthusiastic about nursing, for example. The case is then, and here's your bridge to quant. So you analyze the data separately, the qual and the quant. You you integrated them in a case. And then you've created a scale to compare the cases by how strongly they support your themes. Let me say just a little bit. This is the bridge to quant, because these can be left in a word, or these can be turned into numbers. So let's say that one of your propositions, let's go back to the idea that one of your propositions is that interest in nursing is related to family support. That's a pretty easy assumption, related to family support. So you're looking at the people who have the different trajectories, and you're rating the case using a scale that you have developed. And you rate each case. This is sometimes called a concordance table, in that it's showing, in this case, it's showing how the mixed analysis compares. This is a very nice bridge to the quant. Let me stop there for a minute. I've probably overwhelmed you already with these examples. There are a lot to digest, I realize. Before I go, let's stop right there and chew on this a little bit and see what questions people might have.
So Dr. Creamer, maybe I'll start with, there was just one comment before you went through these examples from Janine Bittner, who says, I would like to know if, in your opinion, it is always necessary to take a clear position with regards to paradigms or worldview. So is it always necessary to clearly position myself paradigmatically if I conduct MMR?
It's helpful in the reflexivity and usually comes down to one sentence. So people would be concerned about space and that kind of reflexivity, but often it is a single sentence, sometimes a single word. A team of feminist researchers, for example. A team of researchers using a constructivist approach to grounded theory. We engaged a dialectical paradigm by looking at differences between the qualitative and quantitative data. So it's not a sledgehammer, but you will usually see a sentence like that. Usually it's in the introductory material. So it's very helpful, very helpful, but necessarily has to be brief.
Thank you. And I'm just like, in relation to that, I'm just wondering, like, your thoughts on, like, in the analysis conversation, like, for example, on a team, when there are qualitative or quantitative researchers, my apologies, would that discussion of the paradigm potentially come up in the analysis conversations?
It could definitely. It could definitely, and where it could be helpful is in recognizing the differences, grounding them in a paradigm. It can be helpful. Although, as I said, I think most researchers are not. This is not something they want to spend a lot of time on. You know, they're trying to get their research done, right? But there's a benefit to recognizing it, because once you recognize it, you say, well, you're really operating from, you're sounding like you're operating from a post-positivist paradigm, because you're really concerned about bias and contamination between the qual and the quant. And I understand that perspective. It's different from mine, but we can accommodate that. We can accommodate that by keeping them relatively independent. So that's that would be a very mature conversation. I think usually when you're in these conversations, you're like, what? You know, like, can't hardly understand how they think so extreme compared to you. And usually often there's status differences in there. So it's hard to be very frank about it, because usually the qual, well, in the past, the qual researchers not at the top of the hierarchy, I'll just put it that way. So let me move on and show some easier examples of integration.
Could I offer you just one more, another comment that came in?
Oh, please, please. I love them. Yes.
Comment mostly. The last example of the concordance table reminds me of the SEM method of latent case analysis, with the added advantage that latent case analysis tends to find a whole wad of unclassifiable people. And this kind of method might illuminate why that is. Mm-hmm. I'm really excited about all the possibilities in these examples.
Thank you for sharing that, because I didn't know that. I knew that there's a mathematical basis for the concordance table, but I didn't know what to call it. I have suggested it to some students, moving it, because it's set up. It's set up to move to quantitative analysis, but I didn't know what to call it. So that's really helpful language. That would create a mixed methods section after you go to the next step. So you've got a clear mixed method part, it's the concordance table. And then you've got a clear quantitative part you might return to, and that could be sequential. Ooh, I want to see that paper. I love examples. All right, let's move on to a here's the simplest joint display I have. So let me tell you what's here. I'll tell you this, at the time this came out, this is by Castro. This was the first example. It seems simple. That is a classic joint display with one extra column. So it's classic in the sense that you have your quantitative score. In this case, you could just almost see the spreadsheet this is involved. So let's say you sorted your data by a quant measure: well-being, life satisfaction, high to low. And then related to your quant score, you have real cases and what they said about that qualitatively. So here you've got the quant column and a qual column. I'll come back to this third column. That's a joint display. These are the major way that integration occurs, not necessarily even this sophisticated. This could be a hypothesis. It could be a theme, could be a construct. So maybe your quant score has 4 dimensions or something. And this could be the quant score on the dimension and then the qual data. This is bread butter joint display right here. Usually appears in the results section, usually appears at the end of the results section. Could appear in an article that has a mixed method section. What was innovative in this is this last part here, which is, he called a storyline, but this is really meta themes. So a meta theme or an integrated theme or a blended theme is when I look at these together, the insights that I draw, new idea, new insight that's generated. This is so simple in the sense that it's almost too tidy. So let me tell you what the study was about. This was a study about machismo in Spanish, Mexican-American, not Spanish, Mexican-American men, and the link between attitudes about masculinity and life satisfaction. Nowadays, we'd call this machismo, maybe toxic masculinity views. His is almost so neat that it's unbelievable, because he's showing very clear relationship between those who have the lowest satisfaction score and their views about machismo and the high satisfaction. So it's almost too tidy to be believable. But the question is this last line, this blended themes, the integrated themes, the mixed analytical insight, you could call it anything. This could be an endpoint, or it could lead to something else. So it could lead to additional analysis. Generally, it's the endpoint. It's like the inferences in mixed methods, they would just call them a meta inference. So just sorting your data, your qual data by a quant index. You can do that very easily in Excel. Even I know how to do that, and I'm not great at Excel. A new, this is almost too complicated to explain, but a new, very recent article that appeared in 2021 from a guy in instructional technology arranges his data a little bit differently, but does the same thing in producing a new round of themes by bringing together the quantitative data and the qualitative data. In his case, he was using, I think, factor analysis over here. So this is another way to display a joint display, arrange a joint display that generates new insight. So a classic joint display, you line them up side by side, and that's the end. Just the same as that concordance table. You line them up side by side. Do they agree? Do they disagree? Personally, I don't think it's high quality to leave a study where data disagree and don't explain it, but it can be an endpoint or a move on to another round of analysis. So part of what happens here is you just have a more thorough engagement with the data. Finally, let me show you just one more joint display. Then we'll switch into reporting, take a few more questions. I think I see some more emerging. So here is the first in, I believe, maybe 4 examples I've seen now. A dissertation in health field by a woman from Japan who I know, who worked with Natalia Ivankova. And her topic now seems kind of out of date, but it was about getting health education through public media. Only in those days, it was the radio. So like how much, let's say she's trying to understand how much education about health issues do you get from media sources? And again, she used a grounded theory. But what this is a joint display because it's showing a theoretical model. And what's really unique is it's not entirely a qual model. So she used different symbol systems to show the qual data and the quant data, and when she had both. And she has pathways, connections. This is the outcomes. This is the strategies. This is the amount of exposure. So she's created a classic model, inputs, outputs, the interventions at the center. But it's integrating both qualitative and quantitative data. And she used dotted lines to show tentative. This is integration. The whole model is a meta inference, because then she's stepping back and looking at the phenomena holistically. So this is a theoretical model that is integrated. So before we switch to reporting, I'm sure it packed your brain with a lot of information. Let me do a polling question before we open to questions. Would any of these, do you think any of these strategies for mixing would be useful to you in your own research? Mixing during data collection, mixing through case-based analysis, joint displays, or no, I just can't see the applicability to my own research. I will put that one.
It's hard to choose one.
Oh, good. I hadn't thought of that. That's really good. All right, let's see what we got. I'm very excited about the idea about the joint displays. Do we have a total yet? Nope.
Yes, I have a couple of comments. All of the above, all are great.
Oh, I'm so glad I could explain them well enough that they could, you know, they're hard to explain because they're innovative. they're innovative. I'm not saying these have been widely used. Mixing during data collection, 39%, joint displays, 52%, case-based less. Oh, there's a lot. It's just that they're starting places to spark ideas, to see how you can adjust them to your own situation. These aren't the kind of things you see that are standardized, you know, they just reflect your own setting and how they could be useful. Thank you so much for that. That's great. Okay. Bring you back in, Dr. West, for some questions, but we're going to shift to reporting now after the questions.
Yes. So I put out a message, any questions that anyone wants to offer related to these approaches?
They're complex.
There were just a couple other comments saying during data collection and joint display that it's difficult to choose between the options.
That's not a bad problem to have, right?
Oh, it's great to have options. Yeah.
People think that graphic illustration, well, I guess historically, doing data collection the way I'm proposing, people think of it as something you do with children. Or it's been most widely used with children. But if you think of situations now where we're engaging linguistically very diverse groups, they're helpful in that setting. They're also helpful in a setting where, regardless of your views about yourself, there's a tension introduced by the sense that there's a big status difference. And your participants are uncomfortable in supplying information to you because you seem like an authority, even though none of us ever feel totally like an authority. So when I say it creates a situation that's more natural. With children, you may have them drawing images and talking while they draw the image if you have the appropriate clearance, of course. All of this is dependent on that. But these work with adults too that have limited, whose language skills may not be compatible with an interview situation. You're not going to get the, it's an uncomfortable situation. So let's move to reporting. And the argument I've suggested that sometimes our reporting, it's less about that you didn't mix and less about the fact that your qual was so much smaller. It's that the reporting standards don't give you an opportunity because of the space limitations. Sometimes we've mentioned that already, to recognize both of the methods in a way that convinces the reader that you were rigorous when you pursued them. So there are standards for reporting. In NIH was the first standard from 2011. These are the standards that were adapted by the National Institute of Health about mixed methods, and this helps to guide their construction of proposals as well as in reporting. So it's a two-sided coin, things to pay attention for, and they're looking for in proposals that are mixed methods and that are you're going to see in reporting. So the ones that are related to mixed methods research are simple. Provide a reason for using mixed methods. Describe the designs in terms of purpose, priority, sequence. This could be sequential, it could be exploratory. You could say it was a combination of sequential and exploratory. You can describe it as a modified. So you try to develop language that reflects your study and its complexities. You describe the research procedures for each. So you can imagine here you're talking about in the methods section, you have a qual part, you have a quant part, and you have a mix part. The same for findings, the same for discussion. So you just, and the fourth one, describe where integration occurred, how it occurred, and what insight was gained from that. These can seem prescriptive, and they've been criticized as prescriptive. But in a way, they are easy to accomplish, and they help your reader understand you relative to this proposal. They build a case that you really mean it really is mixed methods. You're just not applying that label because they want you to. I have done, actually some time ago, I did a video with this same example that I have used from Christine Catello about the intimate partner violence in emergency room, because it illustrates, and here's an, this is in a nursing research and practice, because it illustrates each of those reporting requirements. It provides a rationale for picking mixed methods. It devotes sections in the methods and finding to integration. It clearly says in the discussion what was gained by using mixed methods. And finally, the reference list contributes to credibility by showing some knowledge of mixed methods. Now, I mentioned that there's some controversy. There's always controversy, right? Methodologies love to differ with each other. So there is some controversy about whether, and Dr. Archibald asked this question in Dr. Poth's presentation. And the controversy involves publications that separate out the qualitative analysis, the quantitative analysis, and in separate publications. The Morse, Janice Morse schools of thought has many an editorial opposing that practice, suggesting that if it's really mixed methods, you can't separate them out. And that's also premised on the assumption, and that's still the practice in that journal, that one is so weak that it cannot appear in a separate publication. So that is the practice for that qualitative health research journal, and still continues to be the practice. This assumes there's a separate qual question, a separate research question, a quant question, and a mixed question. So this is a standard format. Now, the real world is when you do a dissertation or a research project, it would be very inefficient to produce a single publication. What it does, perhaps there's a single publication related to the mixed methods part, which is the case with Catello. So often you will see multiple publications, but one about mixed methods. Where it gets sticky, only the division, and this is more political than you would hope, is when you say, I'm going to report on the qualitative portion of the study, but you call it mixed methods, and in the article you only report the qual or you only report the quant. That will bring some ire down on your shoulders from reviewers. An alternative, now we'll come back to this because it's really a hot topic. if you imagine that all your research questions are mixed, whether the qual and quant are equal in the two parts, then it's less sticky. It's less sticky in terms of separating them out, because it's sort of a contradictory argument, because there's a lot of evidence, there's very little integration that actually takes place. So why people are so worried about articles that separate the qual and the quant, I'm not entirely sure. But the other thing that's often very positive to think about is the potential here for methodological articles. That I can talk more about that if you want me to talk about that. So a methodological article is concentrated on the methods and how you use the methods in an unusual fashion. So example, for the person that talked about how they could take let me see if I remember exactly the right wording, how they could take that concordance table and turn it into latent variable analysis, structural equation modeling. That would be the perfect topic for a methodological article. You're not in a methodological article, you're not reporting. Your emphasis is not on what you found in terms of your research questions, but the emphasis is on the methods you used. And the audience is other researchers who might want to be, who could find the method helpful. So it focuses on the method and the use of the method. And that means a different kind of organizational structure for an article. Reflexive accounts from teams, particularly when you're crossing international contexts, are additional sources of articles you can write that reach a very wide audience. People are very interested in, students are very interested, novice researchers, in reading reflexive accounts. And let's see if we have questions, but I can come back to this because we do have some good time here. So let me stop there and see where we'd like to go next.
Okay, so no questions yet, but from Dr. Mandy Archibald. She sent a comment thanking you for engaging in the controversy, republishing practices, and said part of the challenge we also see is that there is no substantive reference to the other strand, which renders it impossible to assess integration while calling it mixed methods. Also very challenging with larger multi-stage studies that are non-typological or emergent in nature.
Yeah. Oh, that's so good. That's so true. Again, some of it is a victim of the space limitations, but the multi-phase studies that Dr. Archibald is referring to with an emergent design, let me talk about that a little bit. As you get into real world research that's addressing complex social problems like health inequities, that's a huge, huge social problem. And you get in an environment where, like a person, one of the articles I love is by a group headed by Westhouse, and she is a Canadian researcher. She was dealing with 5 linguistic groups, and I believe she was in perhaps Ottawa. And, she's exploring healthcare services to these groups and trying to understand their specific needs. And it was a community participatory action research. So that's exactly the kind of study Dr. Archibald's talking about. One way to handle that one way that helps to handle it, and she's talking about the challenges of reporting that kind of study across multiple publications, is by dividing it out by research question. And the research questions are mixed, so that then you can generally reflect the integration. So let me see if I can be creative enough to illustrate a mixed research question. So a non-mixed research question would be, let's take an intervention. So we're over here in this column. The traditional approach in intervention research, studying an intervention and people's the effectiveness of intervention, is to assume that like the qualitative data would be about the process and the strategies. You know, why did people respond to dance therapy? That's a very qual question. And outcomes, did people's well-being improve over the course of a dance therapy intervention? Do people with chronic pain, there's an example of this in a dissertation. What are the outcomes of people participating in chronic pain? Did their pain reduce? So the traditional approach is to think qualitative questions address strategies, the quantitative stress address the outcomes. But in mixing, when you think about them as mixed, you've got qual and quant data about both. What processes are associated with pain reduction? Can be a mixed research question, because if you have quant and qual data about the same constructs. Classic mixed question is what strategies are associated with the outcome? Now you can imagine you could have qual data about that and quantitative data about that. So shifting to the idea of mixed research question, or some mixed research question, may be one way to alleviate this very powerful controversy. And in the qualitative health research journals, I think there are 4 or 5 editorials about this particular issue. The tension in reporting mixed methods research. So the controversy is alive and well in the reporting domain. All right, I can talk more about methodological articles, but let's see. Those are the slides I took out this morning thinking, oh, it's too much.
Any additional questions or comments from anybody?
Let me just say a couple words about methodological articles, and we'll wrap up there. I mentioned I'm the journal editor of a journal, Methods in Psychology. And honestly, I had a very selfish reason for accepting that editorship, is that I was trying to promote mixed methods in fields of psychology. But it's called Methods in Psychology. And the aim is methodological articles that are centered on procedures or techniques or tools. But many people have a hard time distinguishing between an empirical article and a methodological article, thinking they're one and the same. So I'm going to make a distinction. Empirical research is reporting empirical research is like what we love. Like I want to get my findings out, whether the activity I planned or the intervention I planned worked. And here's the evidence. And it taps into your knowledge of the topic. So most of us have an expertise in a topic. Like the example I gave you from Shim's dissertation, she was very interested in dance therapy and its impact on chronic pain. You see many studies about the impact of mindfulness on chronic pain. So in an empirical article, you're showing your chops, if I could use that expression, by a reference list. It's all about the topic. It's all about mindfulness. It's all about dance therapy. And there's no articles about methods. But in a methodological article, what you're interested in doing is showing, for instance, let's say that you have a joint display that was a real breakthrough for you. And when you aligned your joint display in a certain way, and you played with it and you played with it, and you had draft 1, draft 2, draft 3, draft 4, and boom, it opened a door to insight that was a big surprise to you. So what you're sharing in a methodological article then is how that joint display worked for you. So the empirical results recede to the background, and where you have to show your credentials, in that case, it would be your literature review is about joint displays, how joint displays have been used. You use yours as an example. That's what a methodological article is. And every mixed methods dissertation could produce, every student could produce a methodological article from a mixed methods dissertation. It's a very good use to illustrate how in this discipline with this topic, these tools prove useful. And there are many, methodological innovations. You usually see the word methodology in the title of the journal, so they have specific focuses. It's a very good venue. So really that's where we can stop here or see if there's more questions. Very helpful. My brain is popping. Probably worn everybody out.
So Dr. Kim Mitchell sent, I'm just going to read it out to you. I had this exact problem described when publishing my Delphi mixed methods methodological paper. The reviewers couldn't shake that it wasn't a study report. And this was at a methodological journal.
Whoa. Now that's interesting. Wow, that's disappointing.
Yeah.
I don't know, you probably did this, but like in your purpose statement, you say this is a methodological commentary. But that's amazing. It's a methodological journal and it's criticized for not being empirical. Usually you can't get any methodology. It's usually people don't want to talk about methodology. They don't want to incorporate the literature. They don't want to read about the method. They just want to talk. That's really amazing. Find another journal. Nursing research shouldn't be restricted to nursing journals. The wider methodological framework, like journals like Methodological Innovations, Quality and Quantity. I know your first home is your disciplinary home for journal publications, but does not necessarily have to be that. And there's a huge advantage to that in terms of expanding your audience for your work. So when you publish on a topic, pain management, mindfulness, the mindfulness people cross-disciplinary can get excited about it. But when you publish methodologically, your audience is even bigger because they're interested in the method. Delphi technique is a method that's used in many disciplines. So whether you're in psychology or sociology, someone might pick it up when they see, oh, mixed methods and Delphi methods. Wow. I want to learn more about how I could use it in my discipline. So that topic crosses disciplines. And that creates a wider audience for your work. That's part of the reason the Journal of Mixed Methods has such a high impact rate for exactly what I'm just saying. So I don't want to suggest that's by any means the only journal that publishes mixed methods research. In fact, the majority of research is not published there that's mixed methods. But part of the reason they're so has such a high impact factor is because people are interested in learning about the method. So whether you're writing about climate change, or you're writing about health inequities, or you're writing about economic practices, people want to know timelining. Oh, mixed methods in timelining, mixed methods in Delphi methods, mixed methods in graphic elicitation. So anybody using graphic elicitation, regardless of discipline, oh, here's an article on graphic elicitation. So you tap into such a wider database that's good for your own evidence of your own impact as a faculty member. That's an important criteria, is demonstrating the impact of your work. And eventually you like that to be also outside your discipline. It's fun. All right.
Agree. And there was another thank you for sharing the idea of writing a methodological article linked to an MMR dissertation study.
Oh, good.
I do think they're really valuable. I think so many people, when they're developing new methods or innovative approaches, there's this sort of just that opportunity is lost.
Mm-hmm.
Yeah.
Also keeps the impression, it shows you that methods are continually evolving. They're not frozen in stone. They're not straitjackets. People continue to modify them so that's helpful, rigorous, but helpful. And I think that's another reason why methodological articles have such an appeal.
And from my experience, we recently wrote a paper on a arts-based method, and I feel like I understood the arts-based method in a much more in-depth way after we wrote the methods paper.
Were you working with Archibald?
No, not on that one. Yeah. But yeah, so I just felt like getting into the philosophy and theory and analyzing what we did with using it as a method, it just really deepened my own understanding of it.
That makes sense.
Research method. Yeah.
And often in some of these methods, procedures, it's not like I don't know how many you consulted for arts-based, but a dozen? Would that be a fair guess, Dr. West? I mean, how many articles you read about arts-based research?
Well, this method in particular, it was described in the arts-based literature. I'd say there were 3 places to read about it, but it was a very limited description.
Yeah.
And then I actually worked with somebody who was an expressive arts therapist. And so then adapting it as a method in our research, I just think those kind of methods need to be well described and analyzed and grounded in theory and philosophy in a much richer way than they tend to be.
And really, you're serving a pedagogical and instructional thing. You're helping other people learn about the method, because as researchers, our repertoire of research approaches our training about it has to continue to evolve. It's not frozen in time from our doctoral work, or it shouldn't be. So by educating yourself that way, and that was part of when I asked you how many, like take joint displays. 3 or 4 major articles in Mixed Methods about joint displays, and would establish significant expertise. So it's not like you have to go out and get another PhD. Some of these techniques, it's deeper than that. It's harder than that, but for many, graphic elicitation is a pretty big database, but that doesn't mean you have to read it all. I think it's readily grasped. But I agree, it's a great way to think more about the method itself.
Yeah. A couple other comments and questions. Wendy offered, I very much appreciate the suggestion about exploring the reference list from dissertations that used MMR. Curious to know if you have any awareness of administrative-oriented MMR work.
Administrative school-based? Can I ask for clarification there?
Sure. They just administrative work, orientated MMR work. Maybe they can send me a comment now in the chat.
I have seen good research about good MMR about school leaders. And when I use the word school, I mean, in our land, it's K through 8. You probably have a different system. Effective, I've seen, I think it's, there's some exemplars in my textbook. I think it was Jang, explored effective leadership in challenging situations. In other words, effective schools in low-income neighborhoods is really what challenging meant.
So I need to clarify that exploring health human resource activity.
Oh.
The focus was there.
There is a good bit of literature that crosses business a little bit. Certainly Mixed Methods, Ross Cameron in Australia and a guy in Spain, Molina Azarin, both do mixed methods in business fields. I don't know if human resources is in business fields. So that's about as far as I can go on that one.
Okay. Thank you. And then another comment from Dr. Diana McMillan. I work in both qual and quant, and I'm curious that the more I've learned about quantitative tools and physiological measures, that they are often subjective and nuanced influences on the foundation of those tool or measure developments or analysis that seem hidden by a removed stance for a standard tool. The MMR approach helps to better link those two worlds more explicitly.
Oh, that's so true. It's also related, let me build on that just a little. It's also related to the cultural dimensions of some psychometric research that are ignored. But let me give you an example of that, which he's talking about right now, to bring that idea, make it more practical. I've worked a lot with a former student whose name is Dr. Cherie Edwards, and she did research using acculturation theory. Now, given today's time, if you went out and looked at the research about the instruments behind acculturation theory, you would be shocked because it is so 1950s about what acculturation means. So they're talking about immigrant groups, and the assumption is that assimilation, the whole thing's about assimilation. Like, it's good to assimilate, give up your language, give up your health practices. And so this classic, well-established instrument continues to be used, sometimes without challenge, because it's a quant measure. But it's so incredibly out of date. It's appalling. So I do think it's important, perhaps what this brings out is the importance of looking at these measures. They're easy to find, and maybe they've been validated. I'm not saying there isn't data about the reliability, but you really do need to look at the cultural and the cultural implications of these instruments. I get all excited about that topic. Yeah. So it's a very good, very, very true.
Yeah. And Wendy, who had asked about the administrative MMR work, just sent a thank you and said, was looking at the business literature, but now we'll look for those two researchers specifically that you all comment on.
So it was maybe school administration. Yeah, the Jang et al. One was a dissertation, an award-winning dissertation, appeared in a really top-tier journal. Mixed methods and school leadership and challenging situations will pull that. That is a beautiful mixed method study. I cover it in my book.
And Dr. Kim Mitchell, just in follow-up around the Delphi study. So much of the mixed methods analysis is emerging as you go. You make it up based on what you see in the data. So there should be more methods papers. That was the inspiration for the Delphi paper, because there was no guidance in the literature specific to analysis for instrument development. Yeah.
And I think it's the good researcher. It's a sign of good research. When you adapt, you make adaptations as your data emerges, when it emerges in unexpected ways. So you leverage that rather than ignoring it. How can I say that? Ignoring it. So for instance, here's a bad example. Let's say you're in the discussion section of a mixed method paper, and it says that let's say they have a concordance table, and 2/3 of it is disagreement. These are things that need to be pursued rigorously to understand and offer an explanation for why they differ. And the beauty of that is often that's where the original insight is. So if they agree, great, check the box, you know? But if they disagree, it could be the instrument itself, and it's a methodological limitation. The instrument isn't sensitive enough to have captured the complexity of the construct. Check, that would explain it. But it can also lead to some very in-deep understanding of why they are different. And that often, in exploring the why they are different, often is where there's tremendous theoretical insight and understanding. There's usually something in the context that's influencing an interaction that the theory might predict, for example. It's not happening in this environment. It seems to disagree with the theory. to end a paper saying it doesn't support the theory, that's pretty good. That's a pretty good ending. That's not, that's an eye opener. But an even better ending is to say, you took some further steps to understand and you dismiss the idea it's just because of my methods. So most people will say, well, if they don't agree, it's simply a method problem. Your methods weren't any good. Meh. Let me give you an example of that. Let me go back to Catello. So that's an example of what I just said. This Christine Catello, I'm sorry to keep, I don't know the woman, I never met her. So it turned out the willingness to disclose had nothing to do with the emergency room setting. The emergency room setting, creating privacy, the ability to talk about domestic assault. It's too strong to say it had nothing to do with the setting. It had all to do with an extraneous condition beyond and above so the people were unwilling to disclose who had the most evidence of physical assault because they were afraid, and she reports this, they were afraid of police and welfare intervention. So she offered an explanation for what seemed counterintuitive, that the people with the most evidence of assault were least likely to label it assault. Sorry.
Thank you. And I'll just add, Dr. Marnie Kramer sent a comment. We have been utilizing students' clinical reflections paired with learning inventories, validated coping tools to understand the role of affective learning in the development of clinical judgment in undergraduate nursing students. Your presentation has provided more clarity and many ideas on how to move this work forward.
I'm delighted. That's really gratifying. Wow, that's why we do this kind of work. That's really gratifying. That's really gratifying.
Mm-hmm. Any last comments or last questions for Dr. Kramer from anybody? Dr. Mitchell had made a comment that was how unfortunate it is we can't have a conversation. And that's one of the limitations of not being in person. But
yeah,
of course, there's always the possibility of reaching out for further conversation. And absolutely. I will mention also that the video of today's workshop will be put up on the Helen Glass Research Symposium website, which is in the College of Nursing website section. And I've also asked Dr. Kramer for some related reading. If people want to read and learn more, that might be another great opportunity as well. Mm. So from lots of thanks coming from Dr. Suma Clement. So appreciative of you sharing your vast experience and expertise. Thank you.
Oh, thank you so much. It's been a true delight to talk to this group. You're applied, your research is applied. Mixed methods works great with applied. There've been so many good examples, or there've been enough good examples that I think I can imagine the kind of work, some of the kind of work you do.
Yeah. So lots of more thank you. So I just want to, maybe we'll coming close to the end. I just want to really thank you. What an honor it has been to have both you and Dr. Cheryl Poth here to talk about mixed methods research methodology. I remember when I was fairly new here, I remember I was at the Children's Hospital Research Institute of Manitoba, and one of the researchers there was talking, I really remember this comment, that in many grant applications, one of the key critiques around when it was a mixed methods research proposal was what the integration piece was. I always remember that for some reason. So having, you come and have some conversation and some space to learn about different approaches, specifically around that integration piece, in the context of mixed methods research has been really, really wonderful. And I, for one, am really looking forward to reading more of your work as I move
it's
forward.
A real frontier. The integration piece is a real frontier. It's moving forward, and technology, even as simple as the Excel spreadsheet or software, qualitative software, is helping to make this like more and more possible, even though some of these, so I try to concentrate on examples that don't require sophisticated software, but it's very exciting. It's an exciting arena to talk about because people are doing things that are so amazing.
Yes, yes. So I just for a few thank yous, I just want to thank Dr. Neva Dick, the Dean of our college, for her support of the symposium and the work that we do in the symposium, the support of our students as well, and the graduate student poster competition. I want to thank the members of the planning committee. I'm here today, but there are so many people that put so much effort into this, as well as those at the Manitoba Center for Nursing and Health Research, which was established by Dr. Helen Glass. And I just, just reflecting on her enduring legacy in having the vision in creating this space where we could have these kinds of conversations is so important. And to end, I just wanted to share with you, I think Nitha mentioned that in 21, Dr. Helen Glass was acknowledged by the Nellie McClurry McClung Foundation for being one of the 150 trailblazing women in Manitoba. And in relation to that, Susan had talked about how much it meant to her to see her mother's impact on the nursing profession continue to be recognized and remembered. And her quote was, "My mother made an impact on so many people. She loved her students and would do anything to make them better. And as she got older, we'd hear from her caregivers about the impact she made on them. Even late in life, she continued to elevate her profession, one nurse at a time."
Whoa, you're getting choked up there. So impressive.
Yeah.
It's given me an idea, maybe something I should think about doing.
Yes. So thank you.
Thank you too. This is what an impressive organization and activity. I've been delighted to be involved. I truly mean it. It's been good to get to know you as well. Yes. And your team.
Yeah. And thank you to everybody who came and took the time. I know that's not always an easy thing, especially in September. You make this the event that it is. So thank you. And I hope the conversations will continue among all of us. So thank you very much.